Hi, my name is Dr. Ingrasha. I'm a chiropractor at Sport and Spine Rehab. Oftentimes we get questions from different sorts of providers about how we manage whiplash from a conservative standpoint. After the initial doctor rules out any major serious pathologies, it sort of raises a lot of other questions on what's next and what's best for the patient. I really like to stick towards clinical guidelines that have been research and evidence-based. Among those are corrective exercise, making sure that patients are mobilized, and mobilizations and manipulations are warranted. We do soft tissue work, and we do a lot of return to play or return to activities very early on in treatment. So corrective exercises are a really big part of what we do. In fact, that's probably where the most value comes, both doing the corrective exercises both here in the clinic and at home, because compliance with the home exercise is very important. Patients don't want to move. It always feels very natural after these types of accidents to just sort of curl up in bed, but along with cervical collars, that type of thing, that sort of immobilization is not good for the patient long term, as long as there's nothing, no serious pathologies with it. So it really starts out with restoring range of motion. We'll do that by things really as simple as head nods or isometric contractions, and we will start it with that to patient tolerance. We always say we want to move as much as we can in a tolerable range. We don't want to necessarily go crank at it in terms of stretching, because then they'll sort of send messages to the brain that, hey, it's not safe to move, and it will continue to spasm up. So it's just a sort of a gentle process of getting the patient moving a little bit and a little bit more until their range of motion is restored. I think manipulations are one of the big things that's sort of a hot topic when it comes to whiplash-associated disorders. Some patients are very acute and they won't tolerate it well. It's sort of a case-by-case basis on how we want to manage those. But whiplash and manipulations and mobilizations have been shown to be very effective in not only just mechanical neck pain, but the whiplash-associated disorders as well. One of the things that I definitely get a lot of questions about are, should I be using a neck collar? I get this from both patients and physicians alike. Currently, what is suggested in the evidence is that as long as, again, there's no serious pathologies that exist, no fractures, nothing like that, that neck collars are generally not necessary. They can even slow down the process of healing by inhibiting some of those deep neck flexors, because now the spine is supported by sort of a physical means. The deep neck flexors have been shown to be turned off after these types of accidents, and we do want to turn them on. So doing corrective exercises for that and allowing normal neck motion helps to turn those on a little bit sooner. So we find that we can return to activity a little bit faster if we avoid that neck collar. Is that chiropractic has a really good grasp on multiple disciplines. Doing manual therapy, like a massage therapist, is part of our scope of practice. So is physical therapy as well. We do a lot of corrective exercise, and ultimately all these things help the patient, and having all that under one roof or a few practitioners is a good way of saving money both for the patient themselves and to the system. If you have any further questions about anything I've talked about in this video, my contact info is below. You can feel free to email me. Also below are some of the clinical evidence guidelines that we use here in our clinic, and hopefully it will make it easier for you to make your own clinical decisions as well. Thanks so much.